My name is Dr. Kyle Varner. I'm a freelance hospitalist at a variety of hospitals across the United States.
Okay, now tell me what you think about electronic medical records.
Well, I've worked with just about every electronic medical record there is, from Cerner to Epic to all the military systems like Alta and CHCS. And for the most part, they're a step backwards from the paper records. When I was in medical school, we would actually write our progress notes with carbon paper, so we had 2 copies. And there are problems with that, but the problems just get worse when you have people who don't do the job trying to design a software system to waste doctors' time. I spend more time at the computer than I do face-to-face with my patients.
What would you say is the absolute worst thing about the electronic health record?
From my perspective, it's data overload. So you have a progress note that somebody sends you that was made in an electronic medical record, and it's 6 pages, and there's one paragraph somewhere in those 6 pages that contains a narrative of what happened with the patient, and the rest of it is all compliance information.
You mean everything that you need to do for the health plan?
It's auto-populated nonsense. They have an auto-populated problem list, which means every single visit they've ever had of a doctor in their life and a diagnosis that was billed for. They have auto-populated vitals from the last 20 visits. They have auto-populated med lists that are out of date, always out of date. They'll have an antibiotic they were on 2 years ago up there, and you think, are you still on this? It's crazy. They auto-populate because they have to do this, because the purpose of a note in medical practice today is not really to communicate what happened. It's to check a bunch of boxes so you can bill.
And so, have you had any particular incidents where the electronic health record has perhaps been a safety problem, or you have almost missed something?
Yeah, electronic records do compromise care, and the reason they compromise care is because they can be so complex that critical data gets hidden. And we have lots of ways to try to avoid that, like getting a call for critical lab values and so forth. But when you have a complex system, because they try to build these overarching things, and then you auto-populate and know so much data, sometimes you think you know everything that there is to know, but the important thing is hidden somewhere. And so you can spend hours just trying to dig through these things.
So for our listeners, what's the one thing you want to let them know about electronic health records from a physician's perspective?
It's a major problem, and you need to talk to your doctor about your past medical history yourself. The worst thing I can hear a patient say to me is, oh, go look that up, it's in the computer. It's your responsibility to yourself to know what medications you take and why you take them. And if you do that, and you're going to reduce the risk that your doctor makes mistakes. Have responsibility for yourself with your own brain.
Thank you so much.
Thank you.